All the listeners of Health Education Lecture Series, I'm your host Gurdeep Singh Sandhu, homeopathic consultant. My clinic address is 9701 Sarah and Court, Dublin, California 94568, and phone number 408-687-1899. Anytime when you are suffering from any disease at any age, please call me for your opinion about your disease, or even if you are being treated by someone to get your second opinion about your disease or about your treatment, you can call me at 408-687-1899. There is no fee for consulting your treatment for that one. So it's a free to consult on phone, and if ever you go with treatment, yes, there is a fee. Uh, and reasonable charges are charged. Mostly people are coming to me for the chronic cases, which are not being cured for the with the other systematic treatments of allopathic side or Ayurvedic side, whatever it is. And I can just tell you from my experience of 52 years that what is wrong in your system or in your treatment, and where it has been stopped, what are the reasons behind that, so that you can correct those things, those errors, and your treatment can go to the end result that you are cured. So in this way, for any disease at any age, you can call me for my expert opinion based on my 52 years of medical practice. Here in these lectures, Health Education Lecture Series, we are delivering these lectures since many months and many more years, you can say, since I came here in the US in 96. Since then I am delivering my lectures in Punjabi and Hindi and English in all three languages, on different radio stations, different TV stations, and also in the newspapers. I'm trying to convey this message, this health message, how this body was constructed, how this life was starting, and how they developed, and what were the complications, what were the hurdles in the normal go of life, and how the nature was curing those hurdles. And that's why we are surviving here. It means whatever was happening in the initial stage of life, even persons were suffering from the complications, persons were suffering from the diseases, and they were cured. That is why their generation is going on, and we are here surviving. So it means there might be a foolproof data and foolproof systematic way to learn for that, how the diseases are appearing, how the diseases are cured, and what are the scientific natural approach to the diseases to get them cured. So I can guide you about that one. So in these systems, since now till this period, I have given you the details of how this life was started, how the sperm and ovaries were met. Even before that, the history of or the physiological explanation of the menstruations, and also the formation of the sperms, and their lifespan, and everything I have described systematically. And after that, when they both meet in the fallopian tubes, how they were developing the life, and ultimately they were entering into the uterus and the mother's womb, and they start developing a new type of lifestyle, being supported by the mother, by the placenta, and all that. So I have described those area for 280 days, how this life was living, spending 280 days in mother's womb, and what were the complications at that time he can face, and how those complications were cured and removed. Whereas The nowadays the medical science has many of the things recognized even before the delivery of the child. Previously, what was happening? We do not know what are the abnormalities in a child, and when the child is born after 280 days with the abnormalities that is known as anomalies, born with anomalies, then we come to know, oh, these are the defects. They are developing, and they were developing inside the mother's womb, and now in a broad spectrum they are coming to us. But nowadays, we are sufficiently intelligent. Our medical science has developed the criteria that we can know them, we can understand the abnormalities, and even we can recognize them even at the 13th week of pregnancy. So, at the time of 30th week of pregnancy, means after 3 weeks. Okay, after three, you can say the 12 weeks, 3 months, sorry. And even at that time, if we have developed developed a system which can tell us what's going on with the fetus in the mother's womb, what are the abnormalities there, it means we are able to, and ultimately, if not, ultimately in due course, we will be able to cure those abnormalities even in the mother's wombs. There are some chances, there are some type of surgeries we are performing, the medical science is performing nowadays, and some of the abnormalities are recovered inside the mother's wombs, and the fetus is again placed into the mother's wombs unto up to the 280 days, the full term. So, in this way, I have described you all the abnormalities, mother side abnormalities, fetal side abnormalities, and their developing life abnormalities up to the 280 days. And after that, I have described you about the mechanism of labor. What is labor? When this child comes out of mother's wombs, this is known as labor. And this labor, why this labor occurs? Because if the child was surviving inside, he was jumping, he was dancing, he was living a normal life supported by the mother, then why he is coming out? What are the problems? How the labor starts? What are the reasons behind that? And then we come across that period that yes, it has to. If it has to, what are the stages since beginning of the labor, first stage of the labor, how these are progressing, and what how you can recognize that this is the first stage, second stage, or third stage of the labor. So I have described all those things as systematically, one by one, and even the complications in between all these stages, and the complication in first stage, complication in second stage, complication of the third stage, systematically I have described in these lectures, so that in each stage, any complication which is possible, and we have means now how to remove them at that period, so that we can have a healthy child, we can have a surviving child, not the stillbirth or all these. Previously, many of the children were dying. They were spending the full term, 280 days normal way in the mother's womb, but at the end of these 280 days, when it is coming out from the mother's womb, at that time, most of the children were dying because of some complications, abnormalities, the pelvic abnormalities and the mother's abnormality, and also some of the rhesus factors. Many of the things I have described one by one, so that you should be well aware of those things. That if something is happening to any couple, that their children are dying, their fetuses are dying at the time of delivery, so that they should be well prepared beforehand, so that the next child, next fetus should not die in this way, and there should not be any stillbirth in that couple's life. So this is what I have described everything. And after that, when this child comes out, management of the child, of that child, newborn child, management of the female at that conditions, everything systematically I described. And after that, the life started, the new life, and that new life has been divided further in some groupings, so that you can understand the normal way easily, that what are the complications, what are the diseases of the first stage newborn babies, what are the complications of the second adolescence age, a toddler's age, then adolescence age, and all those things, and pre-adult age. So what are the complications systematically, and what happens, what astonishing things were happening at that phase, and even that those things were happening even in the mother's womb at that time, but we do not know much about that one. But even something happens in front of our eyes, just like I explained previously, that a girl or a boy at the age of adolescence, when he is turning to be adult, at that time their sex is changed. A child becomes a male child becomes a female child, and a female child basically they are no more children at that time, and they are conversion, and that's very astonishing things. And about that one, I have described everything why these things are happening in life, why why a female child is converting into male child while a male child is converting into female childs. So all these things were happening normally, and but we were not known to that one. We were thinking this is astonishing thing, and you can say a God's will. Okay, so but I have described you the physiological factor, what were happening inside mother's womb, what was happening inside the body of the fetus, which was made from the sperm of the father and the ovum of the mothers, and they were having something common in their further life of the fetus, but they were still fighting for their supremacy, and that supremacy has resulted the chromosomes, and those X and Y chromosomes, they were fighting for their supremacy even in the period of mother's womb, and even after that one. And after that, even at the time of adult age, when he's converting to be adult, converting to be adult means the signs of secondary sex character. Secondary sex character I have described in these lectures in detail, that when a child, when male or female is converting or is entering into the age of adult life, they are having some of the peculiar signs and symptoms which differentiates them even outwardly. Because when a child is of a young age, and if you change his clothing, if you change outwardly, no one can recognize that he is a child. Suppose if you dressed him, a boy is dressed like girls and a girl is dressed like boys, it is very difficult outwardly to recognize whether it is a male child or female child. But now I am talking about that age which is outwardly, you can say, indicates that you can recognize him easily that he's a boy, he's a girl, even if even if outwardly they are addressed adversely. A girl is addressed as a boy and a boy is addressed as a female. Even then there are some signs, if you do not change them, just like the ostriches, the beards in the males, just like the menstruations in the females and development of the breast in the females, all these things happens, a change of the voice, physiologically. All these things happen physiologically, and you do not have control on that. Yes, there is a control on these things, of the hormones, because nowadays doctors and the medical science has developed the knowledge about the hormones, and they are using this hormones like a magician. They are changing the physiology of a body from male to female, female to male, with the effects of these hormones. So the medical science has learned about that one. But this is naturally, automatically happening inside the body of the female, inside the body of the males, that they are having a conversion. Even I have told you, by nature, by nature, there are three chances of female birth, there is only one chance of male birth. Just like I explained all these things, that there is there are 23 pairs of chromosomes, and out of one pair has X chromosome and Y chromosomes, whereas in the females they are having 23 pairs, and one pair is having chromosomes, that is having X and X chromosomes. So one X is coming from the male and two X's are coming from the females, and there is only one Y. There is only one Y. So that is why I told you that there, nature wants to, because a female is the mother of all productions. Female of vegetables, of human beings, of animals, of birds, and everything. Mother is always the responsible for the reproduction of life in same species and same everything. So therefore nature has made female body like having three chances. Two chances are coming from the female body and one chance is coming from the male body, and when they unite there is only one chance to become a male. But even then, the human beings are of nature that they are having supremacy of the males, and that is why they are eager to get male child. And that is why nowadays there are many more clinics testing the pregnancy, and ultimately if they find out that there is a female child in the womb, and they go to abortions. But I was just talking about that, how I what I taught you in these lectures. So under those conditions, uh, first of all, we check all these things at the 20th week of pregnancy. Though we can check it before that. At the 16th week of pregnancy, the heart starts working, and the palpitation and everything we can check with the special type of devices. But at 20th week of pregnancy, means fifth month, we can check the palpitation, a heartbeat of the child from the stethoscope, from the out of the abdomen, in this way. And the same thing, we can check the sex of the fetus at that time, whether it's a male or female. Most people goes for this checking, but this checking was invented for the diseases to discuss, to diseases to diagnose, if a child is suffering from any abnormality in the mother's womb or not. But this test is misused to recognize the sex determinations, whether the child is male and females. So most people are just taking this test only to detect the sex, whether the child is male or females. But sometimes nature is more stronger than our not, you can say, the notorious thinkings that we say, or the our test says child is male, and you are happy because we are, there is a supremacy of the male childs, we like that one. And in that way, what happens, even during the time of pregnancy, even in that periods, that changes. That changes because the fight between the chromosomes was going on. The first indications was that the Y chromosomes were supremacy, and they are forming the body of the male. Whereas after that, when the child is delivered, till that, pharmacy of the supremacy was of the female child, or the X chromosomes. And then sometimes it was very difficult to understand that how it happens. Some people blame the doctors, some people blame the doctors team and in the hospital and all that our child has been changed. At that time, this DNA was not that much popular, but nowadays we have a DNA, and with that DNA we are able to determine the paternity of the child. But it happens. My question was just that it happens in our lives. So even then, that now we are bound to believe that when, yes, this is my child. But ultimately, this astonishing things even still continued. The fight between the Y and chromosomes is still going on. at the age of adult, when this newborn child, toddler's age, is converting into the adult age, at that time, this change we again can see, not always, but we can see this change in the sex of the child, that a girl is converted when there was when there were development of the secondary sex characters, menstruation, development of the breast, voice change, soft and fatty body, and all these things, globular type of bodies, you can say. There are many more other changes. So in this way, this was happening in the life of, in the body of the females. On the contrary, in the male child, the body is becoming more stout, voice is hard, then there are mustache hair on the mustaches, on the beards. This is not happening in the females. But what we see, we have a male child up to the age of 12 or 13 years. But now, and the girl up to the age of this one, and she was a girl, and we were expecting it. Everything is going on normal as per the sex we see outwardly. It's a male or female. It is converted. It's altogether it was converted. Astonishing thing, but we cannot deny now. We cannot blame the doctors. We cannot blame anybody else because we are seeing our child is in front of us. It was developing. My girl was developing. My child, male child, boy was developing. And at that time, in all the sex characters, which should be in the females, which should be in the males, are visible on the side. But in spite of these signs, should be visible. In a female, the menstruation should come up, no. In the male child, menstruations should come up, no. These are not coming up in due course, and ultimately we see that male child is converted into female and female child is converted into male. We cannot disbelieve. We cannot blame anybody for this one because it was happening in front of us. So these are some of the changes which are all because of the fighting of the chromosomes, X chromosomes with Y chromosomes. And still we can say that there are three chances of born a female child and one chances only to born a male child. So this is what in our life is happening, and ultimately I described you about this one, the newborn life, problems, the complications of the newborn, and also how we can manage all these things. Nowadays, vaccination and everything I have described is in this criteria, that vaccinations are developed, and the complications of the vaccinations, the benefits of the vaccinations, what type of vaccinations we are giving, what are the routines of vaccinations we are giving, whether or not we should go for vaccination or not. So I have given the explanations, everything about this one. And then the life was developing into toddler's age. Still, many of the things like a disease or complications were still with that life. And still, the treatment we are giving, the management we are giving to protect this child from the diseases is still going on the same way, just like the vaccinations. And ultimately, it enters into the toddler's age. And that toddler's age I just described has this astonishing features that a female child is converted into male child and a male child is converted into female child. It happens all because of that fight. And after that, I told you this child is developing into a male version, into a male versions. And when I say the male version means in a physical body, all the secondary sex characters are developing in a normal way, normal things. We see that, we believe that. But the pre adult age, an age comes up when all these secondary sex characters are fully developed in the body. Everything is going on normal. The male child is having semen and development, female child is having menstrual developments, female child has breast developments, and the hair of beards and everything. Means a full-fledged developed male child, a full-fledged developed female child is in front of us. But at that time, if we say that now that fight has gone, no, it's not gone yet. Again, a condition comes up that this fight in the Y or X chromosomes maintains you can say, understanding that one of the chromosomes occupies most of the functions or feelings of mental state, and the other thing is following the body structures. So in this way, what happens? A child is a male child. A child is a male child and fully developed, and parents are thinking about that one, that, oh, now we should find out some girls to get this child married. He is now adult. But what happens? Previously, this younghood wasn't sufficiently outspoken. They were not saying frankly to the parents. But nowadays, this younghood is frank and outspoken, and they say to the parents, no, 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 I do not want to marry the girl. I have no attraction with the girls. I am attracted with the boys. And this is what is going on, happening all over the world, this type of criteria. And though in many of the countries this is a crime, just like in India, marriage of male to male or marriage of female to female is a crime. Lesbian or homosexual, all that one is a crime. But now they are thinking on the other lines, because it is not their fault. It's the natural thing which is happening inside the body. You cannot ignore that. And you cannot blame the nature, that nature has done something wrong. It was his process, it was her process, you can say. And in that way, these bodies are converting into their different nature and different physic. Body is female, mentally she is a male. And if mentally is a male, she will not be attracted with the female child. She will be attracted with the males. So when physically looking a male child having mentality occupied by the females, how the female can attract to the females? No, he will be attracted with the males. Is in this way, a female child is having a mentality of the male child. So ultimately, that male child mentally will not attracted with the males, will be attracted to the females. That is why female to body is a female. And that is why they are attracted towards the same sex. We said it, they are attracted to the same sex, but actually, this is all because of the genetic characters, genetic development inside their body. So these all things I have described you, and after that there were few lectures to guide the parents about all these things, and to guide the parents that now you should deal your adult children's going to be adult or at the stage of pre-adult age, you can say, you should change your behaviors. First of all, you are like a dictator. You are dictating everything to your children's. You are commanding everything, every habits, every working, everything about your children's. But now the stage has come up that you have to back up. In spite of instructors, every time you should be advisor. And when we get the advice from anybody, when we need it, consultant. Now, in spite of commanding everything, you should become consultant. If ever your children wants to learn something from you, to understand something, you just give him a open opinion. But if he does not, then all the time you do not push your ideas on him. Otherwise, you see, there were, first of all, in previous days, you see that there was a common houses, okay, united families. even up to three generations, grandparents, parents, children. They were living in one house. But nowadays, the family is considered husband, wife, children. That's all. It has been limited. Because of all these things, the mentality has been changed. And you should have your behavior changed at that stage. And in spite of becoming a superman for your parents, become advisor. You are still superman, but use your supremacy only if your child wants it. So in this way, all these things we have guided you about all these things, and ultimately we stop these lectures at this stage that now we are entering into the adult age, and the whole body has been formed in a specific structure that is known as male or female, and means the body has been formed. So I started describing about this body, means anatomy and physiology. Anatomy and physiology, I described that how this bony structure was formed when it started forming inside mother's orbs. What was the first thing to be started forming, just like the vertebral column on the skull side and all these things, brain systems, they are the first thing to be established, and then the clavicle, and then after that the heart system. And systematically, I told you about those things, that how they start developing inside the mother's orbs. And after that, I told you the structures formation of a head, means the skull and face. You see that they are the bony structures. Inside organs are different, but outwardly, this is a skull, and skull is composed of seven bones. Face is composed of 14 bones, and the total they are having combinations head and face. So in this way, I told you all those bones, how they are composed, how they are fixed with each other, and then they are making a globe of the head. And after that, how this face, zygomatic, nasal bones, orbitals, and everything, mandibular, maxilla, and all these things I have told you about these things. And after that, I told you about the extremities, how this shoulder girdle is formed, means the clavicle and the backside, the backbone, that is the scapula, and the this joint is formed, the shoulder joints, and after that the arms, humerus, and clavicle, and then this one, the radius and ulna of the arms and phalanges, all these things systematically. I give the knowledge about these things. This is what I described, that how this body was formed, total body was formed. In the same way, what the how the neck is formed, how the chest is formed, what are the main structures to forming the chest and bony structures. How many ribs are that, and what are their different changes, differences between each ribs. And same way, the vertebral column, there are different steps of the vertebral column, seven cervical, 12 thoracic, five lumbar, and five sacral, which becomes one, and four coccygeal, which becomes one. So in this way, the vertebral column was formed, and the chest was formed, and then after that, how this pelvic girdle is formed. That's the pelvic girdle is formed by three bones of the hip bones, ilium, ischium, and pubic. How they are uniting with each other and forming this girdle. Then after that, we described about the legs, how the legs are formed, what are the bones, the femur and tibia, the fibula, and everything. So this whole after this whole structure was formed that I described on these lectures, we started about the signs and symptoms of individual area. If they fall sick, what are the outwardly signs? Because if you go to the doctor, if you go to the hospital, there are many more devices to check what organs is sick, what are the outwardly symptoms or inwardly symptoms. They check everything after that. But before you go to the hospital, at least most of the things, they should not be late. We should not be late and get adverse effects of the disease, we should know some of the signs outside, so that you can immediately, whenever they are appearing, you can immediately know about the signs, that these signs are indicative of this disease. This is the problem. And whether it is serious, whether it is non-serious, according to that, you can rush for the treatments immediately and save the life. So I told you about the sign and symptoms of head. Though there are head is not only one thing. There are many more things composed inside the head: cerebrum, cerebellum, mons, medulla oblongata, pineal bodies, and all these things I have systematically described, that what are the components of this brain. But in general, any of the things when go wrong inside the skull, means in the head, what are the outwardly signs? So those outwardly signs will indicate us that something is wrong in the head. So that particularly doctors dealing with that criteria, we can refer to that patient to get immediate relief, to immediate treatment for those things. And then after that, I describe you about the organs of the neck, and if they fall sick, because there is a thyroid, there is a parathyroid, these are the glands having major effects on that one. Plus the inside organs, there is a pharynx, there is a larynx, and there is the epiglottis, there is a trachea, many more things about the neck I have described you, and their functions. And if they fall sick, if there be any problems in these organs, what will happen? What will be the outwardly signs, that you see those signs and you can rush to the doctor concerned in the medical departments? Just like, for example, hypothyroidism. The main function of the thyroid is hypothyroidism or hyperthyroidism, slimming or myxedema, obesity, all these things. Outwardly, we can judge that one, and we can tell the patients that you are having this and this kind of problem, so that he can directly go to that type of doctors and get treated immediately and get a proper treatments about that one. And after that, all the organs which were in the neck and their symptoms. If there is a problem in the trachea, if there is a problem in the parathyroid glands, if there is a problems in the larynx or pharynx or the bronchus, what will happen? So all these signs outwardly, what we assume outward and presume outward, I describe this thing. Then after that, we came to the trunk as a whole trunk. And you know the trunk, from neck downward up to the hip joint, where two legs are joining, area from the shoulder joint downward from the neck up to the hip joint where the legs are joining with that area. This whole area is known as trunk. And I give you the informations about that one, that this trunk area is divided into two portions, major two portions. The first portion is known as chest, which is a cage of bones, ribs. I described about that one, how many ribs these are, and how they are arranged in the chest, and what is their directions and all that, and how they are united to each other. Description of intercostal muscles, description of the sternum, description of the vertebral column, and how they are formed the joints. And up to seventh rib, they are attached to the sternum. Eighth rib is joined with the seventh rib, and ninth rib is joined with the eighth rib. Tenth rib is joined with the ninth ribs, and there is the distension of the abdomen. Means the big gap is given to the abdomen to distend under conditions. So in this way, I described everything about the chest area. And after that, I told you about this one. In the chest area, there are some of the important organs. Rather, you can say the most important organs for life. Though the brain is also a important organs, but even then, you could say every organ has its own existence and importance inside of the body as well as in life. But some of the things are without that one, it's very difficult to run the life. And in the chest area, we have described about the structures of the lungs, heart, and mediastinum. And when I was talking about the mediastinum, I told you it's normally in vague language, you can say a pathway, a common pathway, which is uniting the upper area from head downward, neck, through neck, and up to the chest and abdomen. So it unites the blood vessels, nerves, and other structures, just like respiratory organs, just like the blood circulatory organs, and just like the food pipes. All these things are passing from upward to downward, and some of the structure, the blood vessel, just as vena cava and all that, they are also coming from downward to upward, and they are passing from this common pathway that is known as mediastinum. It is in between the middle of the chest. On both sides there are lungs. On left side, the some portion of the left lung is covered by, is taken up by the heart that I have described you, and even I describe you the situations of the heart. Even then, I will repeat it again and again, so that every person can know that where he feels the pain, where he feels the abnormality, and what is there inside. Valves, and any muscles, anything which happens inside the heart from outwardly, you can check that. You can find out that, you can recognize that one. So this is what I give you the directions, give you the informations about that one. After that, I started giving you the information about this. In general, if any of the organs out of lungs and heart and the mediastinum, any of the organ falls sick, what are the main important symptoms you see outwardly? So that even before going to the doctors, you can recognize all these things, that these are the signs of what? Whether related to the heart, whether related to the chest or the mediastinums. Just like the congestion, pain, tightness, shortness of breath, irregular pulse, dizziness, rapid irregular pulse. Already I told you about that one, and fatigue, nausea. All these things were concerned are the symptoms related to the chest organs. And most of the signs are physical. If these things, the problems of these organs within the criteria of the chest, falls sick, and they are sick since long, many times they may be by birth, they are having some defects, or they have acquired defects, they acquired it later on, but they are since long times. The diseases are, he's suffering, all these chest organs are suffering, any of the organ is suffering from a long time, and it changes some of the physical structures outwardly. Just like I told you, if the cholesterol is high, you can see it on the face. If you see there is a problem in the heart or lungs or chest area, there is a clubbing of nails or dipping of nails. All these things are indicative that something's wrong in the chest areas. So in this way, I describe the the main important symptoms, you can say. The main important symptoms, outwardly you can perceive and you can judge that, yes, this is all because of the chest problems. And after that, does not mean that it's a heart attack. Because I told you, now we have to differentiate all these things, whether the symptoms appearing are related to the heart, to the lungs, or to the mediastinal organs. Because most of the things are common appearing in the chest. But after that, we have to differential diagnose that these particular symptoms are, most of the symptoms are common, but particular symptoms are related to the particular organ inside the chest, and how we can recognize that one. This is what we are going through through that one. So before going to that one, I was asked to tell about the heart attack, and I described about the heart attacks. Mostly people think that if there is a chest pain, it may be heart attack. If there is a breathlessness, it may be heart. But actually, what is going on inside? These are the general symptoms of the chest. But when you say heart attack, sometimes people say, "Oh, it has happened sudden heart attack," and nothing happens sudden inside this body. That is why I'm giving these lectures to you, that you should understand that nothing is happening immediate except the accidents, immediate inside the body. Any change, even the minor change in the functioning of internal organs, indicates outwardly by some symptoms, so that you can understand. If you understand those things, then ultimately you will be able to cure them immediately, and then you will not get the grave incidences of heart attacks, any adverse effects of this thing. But we are ignoring, because we do not know that these symptoms may be so serious ultimately, and there may be heart attack, there may be a serious type of any disease problems. We do not care about that. That is why, I'm giving these lectures to you, that these minor things should be taken care of. And if you take the care of all these things, and then you do to prevent all those things immediately, it will be very easy, and you need not to go to the hospitals, and you will not see this kind of things. Oh, hi, he was just now normal, he has sudden happen heart attack. No, heart attack is not sudden, because most of the things, the causative factor, just like the sugar, just like the cholesterol, all these are the responsible things for this heart attack, and they are not immediate. They takes long time to produce, because there is a resistance inside our body always itself try to protect itself from the diseases, from the abnormalities. It covers it, but if it cannot cover it, indicates outward by the symptoms. Outwardly we see many of the symptoms when this body himself is not capable of making him healthy, keep him healthy, because of some reasons. So we should find out those reasons at that time when it shows some symptoms of any kind. So then we will not be getting this kind of things, that, oh, he was just now healthy, he got heart attack immediately. Heart attack. No, it's not immediately. The next question was regarding heart attack. But what heart attack is, because there are many different things happening with the heart. So, heart attack properly means that when the heart is not getting proper circulation, and the circulation to the heart is supplied by the artery which is known as coronary artery. And the coronary artery has its two branches. One branch, main branch, is coming from the ascending aorta, which starts from the heart ventricle, left ventricle, and goes upwards. And when the blood is pumped out into that ascending aorta, it pushes through the whole body. But when the heart is dilating, the ventricle is dilating, it comes back, but it cannot go to the heart, because there is a barrier. There is a semilunar valve at that time which closes only on one side. It can open outwardly, but it cannot open inwardly. In this way, when the blood comes back downward, when the heart dilates, that stops the heart in between the ascending aorta. And then this blood is given to the coronary artery. And this coronary artery has two branches, right coronary artery and left coronary artery, which is supplying to the heart muscles. And If there is any problems in the coronary arteries, then any of the part of the muscles or the fiber of the muscles, if they are devoid of circulation, they do not get proper oxygen and the food materials, they go die. And ultimately, this condition is known as produced by pain and known as heart attack properly, basically. The reason I told you, the main reason, cholesterol and sugar, they are the same thing. But one natural anatomical structural problem is that the coronary arteries, right coronary arteries and left coronary arteries, they are supplying their individual part of the hearts, but they are not united. And when I was talking about this thing, I told you about the collateral circulation which is going on, which is a rule basically, which is a rule inside our body guiding these circulations. And that rule is that if any artery is cut down, or even the vein is cut down, the purpose of the vein is to drain back the blood. Purpose of the artery is to supply blood to the tissues, cells, every cell. And if artery or veins, because they are going parallel to each other, artery is deep and superficial is the vein. And if anything happens by accident, these are cut down and then supply is obstructed to the distal parts. The parts after that, where there is a cut, supply is obstructed. Then those organs which are distal to this injury, this cut, are supplied by the adjoining blood vessels, arteries and veins, which are passing from the side of that cut. That is known as collateral circulation. Collateral circulation, and that is also possible for the repair of the cut, repair of the injury as that one. So in this way, just to explain this thing, I want to tell you, in the coronary artery, there is no such relation between the right coronary artery and the left coronary artery. They are not uniting with each other. If any of the branch, any of the distributaries of right coronary artery is damaged somewhere, blocked somewhere, it's unable to supply the oxygen and the food, and those fibers of the muscles, heart muscles are dying because of starvations, because of oxygen. They are not helped by the other side of coronary artery, means the left side of the coronary artery. The same thing, if happens in the left side coronary artery, same thing happens on the left side of the heart. It is not supported by the right coronary artery. So that is by nature. That is anatomical defect, you can say. You cannot blame the nature. Okay, in this way, this is what the anatomical problems, and we should know about this thing, and I have described you about all these things. And when there is any circulation problem by the coronary artery to the heart muscles, that is actually known as heart attack. And I told you, nothing happens sudden. Blockage is sudden because it was giving you an indications and you were not understanding those indications. That is why it has happened. But if when it was started and you know about that one and you have corrected that one, it would not have happened to you. High cholesterol, GERD's problems. Regularly, you are suffering from gas problem, bloated abdomens, ultimately, high lipids, sugar problems, all these things, which are the causative factor of concentration of blood or sedimentation of these things inside the blood vessels. If these things are sedimentating in the lumen of the arteries, ultimately the lumen will become narrow, and lumen will become narrow, and the heart has to force more to pass the blood from that narrowed arteries. That's why we have the blood pressure. So if you have blood pressure, it indicates that heart has to use a special force to send the blood out up to the tips of the fingers, and he is using his extra powers. Ultimately, that extra power is indicated by the hypertension, and the causes of the hypertension may be that sedimentations of lipids, that is cholesterol, of sugar, anything which is concentrated in the blood, is anything which is staying more time over there, they sedimentate from the blood, and ultimately they block the lumen. They block the lumen, and then there is no food, no oxygen could be supplied to the further portion, that is the distal portion, and ultimately that produces heart attack. Pain, it is indicative of pain. I told you, the pain is the shortest word, the initial, the first word to be to explain the disease, explain the disease process. After that, this pain has explanation. What type of pain you have, where you have the pains, how it goes, where it goes, radiates, migrates, whatever. So after that, we can come across that this is related to this thing. But first of all, the sign is pain. So we should be well aware of these type of signs of the heart problems, so that if you are aware of all these things, ultimately you will not suffer from the sudden incidences you are recognizing as sudden institutions. These are not sudden incidents happening to your body. They are gradually developing inside your body, and ultimately they have reached to the extent that they are unable to help himself. But you have not recognized their previous cry, previous initial symptoms. If you would have, then you would not have suffered from all these things. You have taken care of blood pressure, you have taken care of your cholesterol, you have taken care of diabetes, and all these things, if they are going normal, and you have maintained your diet accordingly, you have maintained exercise and everything normally of the body, then you will not suffer from the heart attack. So this is what I explained in these lectures. And after that, I also explained that after this heart attack definition, what's the heart attack definition? This is what I explain now. After that, there are other main complications of the heart, that's known as congenital heart defect, or congestive heart failures, or right-sided heart failures, or left-sided heart failure. So all these things, I have given you the symptom in these lectures, that if it happens, what are the initial signs you can see outside the body? If right side heart failure is, what are the initial signs of your body is indicating outwardly? If right side, what are the other signs you can different from the left side you can see outside of the bodies? So all these things I have described in my these lectures one by one, so that you can understand that. And the same thing I described about the congenital heart disease, and about the foramen oval and everything. So this was the, you can say, the survey what we have done till now. And in our next lecture, we will go to the other components of the mediastinum, and if they are having any problems, what will be the outwardly sign we can see that. So please remain attentive, attached to Sabarang radio station, attached to my YouTube medias, also to my Facebook media, so that every day from 5 to 6 California Pacific time, you can join with me and you can listen further information about your body. any abnormality of any different systems of the body and any different part of the body, if happens inside the body, what are the signs, so that you can recognize this one before it goes worst. So today time is over. I am your host Gurdeep Singh Sandhu, homeopathic consultant, and my phone number is 408 687 1899, and email address is homeomedicine at yahoo.com. HOMEOMEDICINE at yahoo.com. So anytime if you are suffering from any disease and you need second opinion, you can call me and you can take benefit of my 52 years of medical experience. Or even if you want to be treated by a scientific approach of homeopathic medicines, yes, you can call me at 408 687 1899, and I will uh, guide you properly. And even if need treated, I will treat you to the best of my judgment and knowledge of 52 years in medical practice. God bless you all. We'll see you tomorrow. That lecture will be in Punjabi. Okay, so that lecture in Punjabi, and that will be for the another, you can say, other parts of the media sign. We will discuss the other parts of the mediastinum, if they fall sick, if there be any problems, and then what are the signs outside the book, and see that one. Sat Sri Akal, Adab, Namaskar.